Hospital officials in Dallas said they were doing everything right, but the Ebola virus slipped through the cracks.
Now a nurse has been diagnosed with Ebola after treating the patient who died last week. We wanted to know how the diagnosis is affecting nurses and healthcare workers in New Mexico. News 13's Gabrielle Burkhardt is live at UNM Hospital. Gabby?
Jessica, healthcare workers we spoke with say they're closely communicating with the Centers for Disease Control and each other to make sure everyone knows how to handle the deadly virus. After 2 Ebola cases in Dallas, nurses and healthcare workers in New Mexico say they're acutely aware of the threat brought on by the deadly virus.
Ebola is unlike any other communicable disease that we've encountered.
Deborah Walker heads the New Mexico Nurses Association. She says they're in constant communication with the Centers for Disease Control.
The goal is that our nurses and the other healthcare providers have as up-to-date information as possible.
Health officials say a Dallas nurse, 26-year-old Nina Pham, tested positive for the virus, which is spread through bodily fluids. Pham had been treating an Ebola patient from Liberia, Thomas Duncan, who died last week. Now there's questions about a breach in protocol, including how Pham removed her protective gear after treating the patient.
It's as important in following a sequence and checklist on taking it off as it is in putting it on.
Now, federal health authorities are cautioning all hospitals around the country to, quote, think Ebola.
We're getting the word out for those nurses who are on the front lines so that they can be adequately prepared for whatever comes their way.
UNMH had a possible Ebola patient in August who returned from teaching in Sierra Leone. She was put in isolation until tests came back and she was cleared. Hospital officials say they will follow the same protocols again if needed. The CDC says they will hold a webinar tomorrow on keeping healthcare workers safe. They want nurses throughout New Mexico to participate. Back to you.
All right, Gabby, thank you. The New Mexico Hospitals Association is trying to assess which hospitals around the state are prepared and, if not, exactly what they need. Major airports have started Ebola screenings, but Albuquerque Sunport says it won't because the concern is much less here. Sunport officials tell us they've discussed Ebola with the CDC and the Red Cross. They say Albuquerque does not have direct flights from countries with the deadly virus. They say those coming from West Africa will most likely travel through one of the 5 major airports where additional screenings are already in place.
So it's another layer of protection which will lower even further the possibility of an Ebola-infected individual getting into this country. It won't make it zero, but it will provide substantial greater protection to people in America.
The Ebola screenings at the major U.S. airports involve public health workers using a no-touch thermometer to take the temperature of travelers coming from West Africa.